Hello everyone, thank you for joining us for our Technical Assistance webinar today. Please let me know if anyone has trouble hearing us and we'll get Brad to fix that for us. He's running our technical assistance on the back end. So hopefully this webinar will be able to answer any questions that you have about applying for our grant application. So this is our 2016 to 2020 Utah Comprehensive Prevention and Control Plan, Cancer Prevention and Control Plan Implementation Grants. For our agenda today, we're going to be going over the purpose, the grant summary, eligibility and restrictions, checklist of required documents, how to submit your application, the scope of work including the various components, and grant requirements and application tips. To submit questions during the presentation, first go to your control panel, which should pop up in the right side of your screen. If you don't see the questions box automatically viewable in that control panel, then you can go up to the View section of your control panel, and once you press View, the drop-down box should give you an option for questions. Make sure that Questions section is checkmarked, and then your questions box should appear below. Now for questions throughout the webinar, we will be taking a couple breaks throughout the webinar after we cover each component. If there's questions that have to do with that component, we will be answering those questions at that time. If there are any questions that have to do with the general application or requirements of the grant, we will be saving all of those till the end of the grant just to make sure that they don't get answered throughout the presentation. So the purpose of these grants, we just released our 2016 to 2020 Comprehensive Cancer Prevention and Control Plan. And so all of these priority areas that you see on the screen are areas that we would like to see lasting and impactful change in. And so we are funding these grants to hopefully have lasting and impactful change occur in one of these areas: physical activity and nutrition, skin cancer, cancer screening, survivorship, and quality of life. So the grant summary applications, the applications are due by 5 p.m. on March 28, 2016. Applications submitted after 5 p.m. will not be considered for funding, and incomplete applications will not be considered for funding. Projects are to occur between July 1st of 2016 and June 30th of 2017. That's also when the funds will be available for the projects. And we are anticipating funding 3 to 6 grants this year, and they will be $15,000 to $20,000 grants each. The applicant eligibility. To be eligible for these grants, you need to be a Utah-based organization in good standing based on the following criteria: resolution of any state of Utah audit exemptions, resolution of judgments against the applicant by the state of Utah, fulfillment of all previous grant obligations by the applicant with the state of Utah. These grants run on a cost reimbursement strategy. So cost reimbursement means that the grantee will be paid for activities performed as defined in the grant. These are usually divided up into 4 installments, 1 per quarter. So these mean that you will invoice the Utah Department of Health for your activities you've completed, and then we will reimburse you for those activities. So the payment is dependent on achieving the goals outlined in the grant. And if some of the funding is needed up front, please specify that with the budget information in your application, and we can make allotments for budget to be available at the beginning of the project. Funding restrictions. So funding may not be used for advocating or lobbying elected officials. That also includes grassroots lobbying, so you or your organization cannot use these funds to go and contact elected officials on your behalf, or have others contact elected officials on your behalf. You can also not use these funds for construction, but please note that funding for equipment or infrastructure will be considered if it contributes to the proposed public policy, organizational policy, or community environment change. You also cannot use them for space, phone, anything like that to run your organization, food, direct clinical services, general operating expenses, and research. To submit the application, please email the applications to Brad Belknap at bradbelknap@utah.gov by 5 p.m. on March 28, 2016. Make sure you put UCCP grant application in the subject line. Submit it in a PDF format attached to the email. And make sure that you are not late. Late applications will not be considered for funding. And all applicants will receive a confirmation via email once their application is received so that you know we received it. The checklist of required items, all of these items need to be in your application or it will be disqualified. So agency background, description of your proposed project, description of need, description of relevant partners, letter of support from each relevant partner, action plan, evaluation plan, plan for sustainability, budget, and in-kind contributions. Just keep in mind all of those need to be in your application or it will be disqualified. For the scope of work, you need to make sure that your project addresses one of the following 4 components. Doesn't have to address all of them, just one. Component 1 is physical activity or nutrition. Component 2 is skin cancer prevention. Component 3 is reducing barriers to cancer screenings. Component 4, cancer survivorship and quality of life. Projects that you are proposing should plan or implement changes to either public policy, organizational policy, or changes to the community environment. So we're going to start by going over Component 1, physical activity or nutrition projects. So within physical activity or nutrition, you only need to focus on either physical activity or nutrition, and Component 1.1 is the availability and consumption of fresh fruits and vegetables. Component 1.2 is for physical activity, the availability and use of resources for increased physical activity. For the nutrition component, projects will work to increase availability and consumption of fresh fruits and vegetables in a school district, large work site, or large population. They need to plan or expand public policies, organizational policies, or changes to the community environment within a target population or geographic location such as a local health district, county, city, town, school district, or census-designated small area. Target populations or locations must have a demonstrated need on at least one of the following: availability of healthy food resources, fruit and vegetable consumption rates, low socioeconomic status. Examples of projects that will increase the availability and consumption of fresh fruits and vegetables include developing or expanding community gardens and farmers markets, providing only healthy, appealing, and affordable food options in cafeterias on school campuses, establishing an employee garden at a workplace, facilitating farm-to-plate agreements between local food producers and community organizations, including schools, work sites, and hospitals. Now, these are examples of projects we've either seen in the past or projects that we've come up with, so other evidence-based approaches may also be proposed. You're not limited to just these options. So for the physical activity portion, projects will work to increase physical activity. They need to plan for or expand public policies, organizational policies, or changes to the community environment within either a target population or geographic location, like the local health district, county, city, town, school district, or census-designated small area. So the same requirements as the nutrition part. Target populations or locations must have a demonstrated need based on at least one of the following: the availability of physical activity resources, physical activity rates, or low socioeconomic status. Examples of projects that will increase physical activity include developing a plan to create safe new routes to school or improve safety of existing routes for cyclists and pedestrians to travel, establishing joint use agreements with local school districts to allow community members to use school facilities for physical activity, establishing policies and creating facilities to allow employees to exercise during the workday. And once again, your projects are not limited to our examples here. These are ones we've either seen in the past or that we have come up with ourselves, so other evidence-based approaches may be proposed. So at this point, we're going to pause momentarily. If there are any questions about physical activity or nutrition projects to fulfill this component, we can take them now.
Doesn't look like we have any questions.
Okay.
Kendra, do you want to quickly just remind people
Yes.
if they have a question, how to submit it?
Yes, and we do have those slides here. Pull them up once again. To submit questions during the presentation, make sure you can see your control panel on the right side of your screen. You should see that questions box at the bottom part of that control panel, and you can type your question in there, and then Brad will receive it, and we can read them when we come to a questions section of the webinar. If you don't see that questions box, go up to the View section at the top of your control panel, Once you click View, the drop-down box will show questions listed. Make sure that questions is checkmarked and your box should appear. And for those of you who have just joined us, we are taking questions about each component for projects related to that component for the application. We'll be pausing for those questions after each component. If you have questions regarding general application questions or questions about due dates or submitting anything with your application, all of those general housekeeping questions we will address at the end of the webinar. All right. If we don't have any questions, we will continue on. So component 2 is skin cancer prevention. So these projects should promote public policies, organizational policies, or changes to the community environment that advance the national goal of preventing skin cancer. They should implement one of the 3 strategies promoted under Goal 3 in the Surgeon General's Call to Action to Prevent Skin Cancer, and these are listed below. They should either support the inclusion of sun protection in schools, planning and development of school facilities and school curricula, or incorporate sun safety into workplace policies and safety trainings, or they can support shade planning and in land use development. The projects in this component should reach a large number of people, so consider working with a large school or work site or several small or medium schools or work sites. And just as a note to that, a school district is considered a large school system. Are there any questions specifically around the skin cancer component?
Doesn't look like we have any questions at the moment.
All right. So we'll continue to our next component. Component 3 is reducing barriers to cancer screenings. And this also is divided up into 2 separate components. Component 3.1 is decreasing barriers to cancer screenings among employees at work sites by changing worksite policies. Component 3.2 is increasing awareness, education, coordination, and reducing barriers in healthcare settings by changing organizational policies. So once again, you do not have to address both of these components. You can pick one of these components within the cancer screening section. So projects in this area should develop or implement a plan to make changes to worksite policies that address barriers to cancer screening. To do this, they should work with management, example would be an HR director at a work site, to decrease barriers to cancer screenings among employees. Projects should reach the largest population possible, so you may want to consider working with a large work site or a group of small work sites. Projects should seek to start programs at work sites that do not have worksite wellness programs or improve upon existing programs. Examples of projects of worksite policy changes that will reduce barriers to cancer screening among employees include allowing flexible work schedules or leave during the workday for employees to get screened, allowing mobile facilities like the mobile mammography units to come to the worksite and allow employees to get screened on work time, developing a reminder system to send reminder cards or virtual reminders to employees who are due or overdue for cancer screenings. Once again, we are not limited to these projects. If there are others that you would like to propose that are evidence-based, you're welcome to do so. So for the next portion, implementing organizational policies to improve screening processes and decrease barriers to cancer screening. And this is in our healthcare setting, so you need to work with at least one clinic or hospital. Examples of ways to improve screening processes and decrease barriers to screening in a healthcare setting include creating a pilot program that models evidence-based strategies for successful quality improvement in clinics or hospitals, establishing patient navigation programs to help patients throughout the screening process, creating a pilot program that models the creation of a medical home for all patients, establishing office policies which support screening such as a reminder system and measure progress regularly, increase the use of health information technology for cancer screening tracking. Once again, these are just examples. If there are other evidence-based approaches that you would like to propose, that is just fine. Are there any questions for the cancer screening component?
We currently don't have any questions at the moment.
All right. So far, so good. We'll continue to our next section. Component 4 is cancer survivorship and quality of life projects. Projects in this area should aim to develop a cancer survivorship navigation program, although it is not expected the program will be implemented during the funding period. So patient navigation is defined as individualized assistance offered to patients, families, and caregivers to help overcome healthcare system barriers and facilitate timely access to quality medical and psychosocial care. So that's what our goal is. We want to help patients through all of their process, from diagnosis through the rest of their life, to make sure that they have the quality of care they need. So cancer survivorship patient navigators may assist cancer survivors through all stages of their cancer journey. And these are programs that will help not only the cancer survivor, but all of their friends and family who help them along their journey as well. So efforts to develop a patient navigation program should include assessing the need for implementation of a patient navigation program, enlisting support from departments or organizations involved in the care of patients, developing program materials like documents, posters, brochures, policies, procedures, forms, all of those things that will help get a patient navigation program in place. So those applying for funding in this component should utilize the following resources to develop their application proposal. There are a lot of evidence-based approaches that have been done nationwide. There are some great resources here available, so make sure that you look through those and make sure that your application includes evidence-based strategies and resources. Are there any questions for this component?
No questions so far.
All right. So now into all of the fun housekeeping things. Contract requirements, data reporting and entry. Part of the grant requirements are that you have monthly conference calls with UCCP staff, and that you turn in 2 written reports, a mid-year and a final report. And they are submitted through the Catalyst reporting system, which is a web-based reporting system. It is free, and we can set all of that up for you, so that shouldn't be an issue. You just need to make sure that you have internet access. And subcontracting is permitted, subject to approval, so that's something that you will need to write in your application. Possibility of project renewal. Additional funding may be available for up to 2 additional years, and that funding will be awarded at the discretion of the Utah Department of Health. So once again, the checklist of required items. Make sure you include the agency background, description of proposed project, description of the need, description of your relevant partners, letter of support from each relevant partner, your action plan, evaluation plan, plan for sustainability, budget, and in-kind contributions. And all of those that are listed with an appendix at the end, those are templates that you can download from our website to include with your application. Make sure that all of those are included so that your application is not disqualified. So application content consists of 2 sections, agency qualifications and project proposals. The agency qualifications is agency background. You need to demonstrate experience with carrying out sustainable and impactful projects. Submit a resume or CV for the staff overseeing the project progress. And the same goes for experience with evaluation. Make sure you also submit a resume or CV for the staff overseeing evaluation. Project proposal content. Make sure you include a description of the proposed project. You can see all of the page limits there. Description of the need, description of your relevant partners, your action plan, and once again, all of those have the appendices listed after our templates that you can download from our website. Evaluation plan, letters of support, plan for sustainability, budget information, in-kind contributions, and also conflict of interest disclosure. For the evaluation plan at minimum should include how you will determine to what degree the project was implemented as planned. This is the process evaluation. Projects also need to include to what degree project objectives were met, which is the outcome evaluation. And those that include both process and outcome evaluation, especially if they're well written, will be stronger candidates for funding. The plan should cover the purpose, the evaluation questions, the methods, and how and when findings will be shared, as well as who they will be shared with. For the evaluation plan methods section, we need to include evaluation data collection. Types of data collection include surveys, secondary data sources like BRFSS or cancer registry data, focus groups, key informant interviews, etc. You need to specify what kind of data you will be using. Evaluation indicators need to be included. These are the variables or data points that would be used in the evaluation. Examples include self-reported BMI, number of minutes exercised, self-reported participation of program, things like that. Evaluation participants also need to be identified. This should involve both information about the participants who will be involved in the evaluation, as well as the number of expected participants. The more specific, the better. Evaluation analysis needs to be included. This should involve, at the very least, some form of descriptive statistics like average age, percentage of participants who completed an intervention, etc. The analysis should be appropriate for the type of evaluation conducted. For example, a process evaluation does not normally include regression coefficients. Are there any questions on this section of evaluation?
It looks like we still have no questions.
Oh, great. Okay, we will continue then. So evaluation criteria, these are how your proposals will be scored. So they will be evaluated against the following criteria. The overall project is 15 points. Project action plan is worth 10 points. Clarity of project objectives and activities in the action plan is 10 points. Project partners is 10 points. Project evaluation is worth 15 points. Project budget and justification is 10 points. Project sustainability, 15 points. Project impact, 10 points. And link to the state cancer plan is 5 points. And this is an example of what the score sheet will look like, so you can get a better idea of the breakdown for each of those point sections. And the full version of this score sheet is included in the application that you download. Tips for writing the application. Make sure that you read the Request for Grant Applications packet from cover to cover. This presentation highlighted just particular pieces of the packet but was not comprehensive. So all of the requirements are listed in that packet in detail, so make sure that you read through the whole thing so that there is nothing that you're leaving out or forgetting. And be sure to address each of the items in the Request for Grant Applications packet. Complete that checklist that we went over a couple times. Many times things will be forgotten and the application will be disqualified because of that. So make sure you have everything from that checklist in your application. Also use the provided templates. You can download the editable versions at our website listed there. That's also where you can see recorded versions of our webinar, and any questions that are answered will be posted there as well. So it's a great resource for you to both download those appendices we talked about to get the template, fill those out so that we get all the information we need from your application, and also where you can get more information on what we're looking for projects. And that way you should have a very good grant application. So any more questions? If you have any more questions that you remember to ask after we have our webinar or that are not asked during our webinar, any additional questions should be emailed to Brad at bradbelknap@utah.gov. Questions and responses will be posted and made available usually that same day, and it's available to everyone, to the public, at our website. It should be available within 2 days of being received. Brad's been pretty good and has been getting it up pretty quickly, so keep that in mind. So this concludes our webinar. We will have a recording available on our website there. We did have a first webinar that was recorded and is posted there if you would like to watch that as well and hear all of the questions that were answered at the end of that webinar. So it's a great resource. Make sure you use the website a lot as well as read through the application packet from cover to cover. Also keep in mind, I believe the last day to ask questions, if you have questions to email to Brad after our webinar, is March 23rd. All right, so we can move into our questions. This is where we have any general questions are accepted. If you have any questions about any of the components that you thought of, or any questions about projects that you want to ask, or any general application questions, we can accept any of them at this time. Just in case people are still having some trouble, to submit questions, make sure you locate your control panel. It should be in the right hand of your screen. The questions box should be located there where you can type in your question to submit. If your questions box does not appear, click on the View portion at the top of that panel. In the drop-down box under View, there should be questions listed with a check mark next to it. If it's not checked, make sure you click that so that it is checked and your questions box should appear.
Kendra, we do have one question.
Okay.
So the question is, in the first section, it was specified that the grant funds could not be used for food. Does this include purchasing food during stakeholder interviews or focus groups?
Do you want to answer that one, Brad?
Sure. This is actually a good question, and I'm glad that someone asked this question because I think that the slide we had in the webinar was actually a little bit incomplete. So in the application, it states under the funding restrictions, starting on page 16, it lists all of the different funding restrictions, and it lists food, but it also specifies that food purchases may be allowed with pre-approval from the UCCP. So to answer this question is if you would like to have food be an expense with these grant funds, you'll need to, that may be allowable, and you will need to include that in your budget. And the Cancer Control Program reserves the right to either allow or to not allow the use of the funds going to purchase food. And the reason that we have that in there is because we want to make sure that these funds are really being maximized for the intended outcome of the sustainable policy or community change, and that the funds don't get really used up on spending for food, which can get quite expensive. So if there is a reason to include food, or there's a role for food in promoting that your overall goal in your application, then please include that, and we will review it. And if your application is selected, we will make a determination as to whether that purchase can be allowable. So at this time, we don't have any additional questions, but we can hang out for a few minutes and see if anyone else has any questions. I think that this is, just as a reminder for those who are on the webinar, this is a really great opportunity to ask questions because you have the full attention of the UCCP staff here who are administering the grant, and we want to help all of you, if you're interested in applying for these grant funds, to put together a great application. So we are at your disposal. If you have any questions, we're more than happy to take them. So we have gotten another question. The question is, are indirect costs allowable? Do you want to address that, Kendra?
So indirect costs, meaning, sorry.
So indirect costs are, for instance, in our funding restrictions, we include indirect costs in general operating expenses. So general operating expenses and indirect costs, any sort of overhead costs that are associated with running your organization are not an allowable expense under these funds. So the answer is no, we would not allow indirect costs for your organization as an allowable cost.
Yes, that's correct. And then maybe as a side note, we do fund staff time if there's someone who needs to work on the project, but their entire salary and benefits should not be relied on our grants to fund them for. So if there is some staff time that is allocated for the projects, we would be happy to pay for their time that they are working on our project.
We don't have any additional questions, but again, if anyone has any questions or if there's just something that's on their mind or comments about the application, I'm sure you're not the only one thinking it, and we would be more than happy to try to address it. Looks like we still have no more questions, so if anyone has any last-minute questions, please submit them now. Otherwise, I think we might end this webinar. Okay, Kendra, I will hand it back over to you. Oh, wait, I think we maybe just got one more question right at the nick of time.
Oh, good.
So we had a question, will there be a training to submit Catalyst reports?
Do you want me to answer that?
Sure.
Yes, there will be a training to submit Catalyst reports. So if your project is funded for the grant for fiscal year 17, what we will do is we'll have one of our UCCP staff assigned to you as your project liaison, and they will be setting everything up for you regarding your action plan in the Catalyst reporting system. They will be teaching you how to work in Catalyst, how to enter progress in Catalyst, and making sure that everything is functional for your end and your staff to use. So there will be a training that will be tailored specifically to you and your staff who will be reporting, and that staff liaison will also be available to help you throughout the year on your project and to make sure that you're meeting requirements, or if there are any resources or help that you need with your project, that's what their role is. All right, if there are no more questions submitted, I think we can go ahead and end the webinar. So thank you everyone for joining us. I hope this answered a bunch of your questions, and if you have any questions that you think of after our webinar has ended, you're welcome to email those to Brad, and he will post the question and answer publicly on our website, so anyone can go there to view that. You can also view our previous webinar recording on our website as well. Make sure that you read the packet cover to cover when you're submitting your application, and use the resources like the templates that are downloadable at our website. And I think that that concludes our webinar. So thank you for joining us and for all of your questions, and good luck with your application submission.